Ear surgeries, myringoplasty, surgery of reconstruction of the tympanic membrane in case of past tensor perforation is myringoplasty. There is only a single material which is used in myringoplasty, that is temporalis fascia. So there is a hole in the tympanic membrane. We use the fascia to patch up the hole. That's the procedure. Two reasons why specifically temporalis fascia is used. Number one is it can be harvested from the same incision that we are doing in the surgery. And second reason is the basal metabolic rate of fascia is very less, and so the graft can survive longer. There are two techniques by which myringoplasty can be performed: underlay and overlay. In overlay, it basically depends upon the area where the temporalis fascia is kept in relation to the tympanic membrane. If the temporalis fascia is put over or lateral to the tympanic membrane, it's called overlay technique. The advantage is that while going through the ear, like from outside, from the environment, we are entering the external auditory canal, and then we are just like placing the tympanic membrane patch, which is the temporalis fascia patch, over the tympanic membrane. So it's easier to perform. That's the advantage. Disadvantage is lateralization, meaning sometimes the patch can distort, displace itself, and lateralize itself, so does not retain its position. Second is there is a risk of secondary acquired cholesteatoma, which is abnormal tissue growth in that area. Third problem is anterior blunting because of fibrous tissue formation. So these are the disadvantages of overlay technique. While talking about underlay technique, the temporalis fascia is placed medial or underneath the tympanic membrane. Advantage is that we'll be able to inspect the middle ear and the ossicles by medial. Okay, but there are certain disadvantages. One, it will medialize, so the graft will go more medially. In the overlay technique, the graft was placed laterally, so lateralization of graft happens. Here it is medial, so medialization of graft happens. That basically means the graft will migrate a little bit medially. And moreover, in underlay technique, we are putting the graft in the inner aspect of the tympanic membrane. The inner aspect of tympanic membrane is just middle ear, so it occupies the space of the middle ear, so maybe reduces the middle ear space. That's the disadvantage. As a quick recap, myringoplasty is a surgery which is done to reconstruct the tympanic membrane. Tympanic membrane has two parts, pars tensa, pars flaccida. Pars tensa perforation is going to be repaired by the technique called myringoplasty. And the graft which is used is a temporalis fascia graft. The techniques which are used are overlay and underlay. Medialization is a problem in underlay technique, and lateralization is a problem in overlay technique. With this, thank you.